Hey, Professor Sokol, it's Taylor for my trach checkoff. So I will come in the patient's room, perform hand hygiene. Hi, my name is Taylor. I'm going to be your student nurse today. I'm here to take care of your trach. I'm going to be cleaning you up a little bit and take a listen to your lung sound, see if you need some suctioning today, okay? Can you verify your name and date of birth for me? Okay, perfect. On a scale of 0 to 10, 0 being no pain, 10 being the most pain, what would you rate your pain today? Perfect. And are you allergic to anything? Okay, awesome. So I'm going to get my supplies all set up and get my patient set up. So I'm going to go ahead and raise the bed. I'm going to elevate my patient so they are either semi-Fowlers or high Fowlers. I have a little drape for them to catch any extra secretions. I do have my suction, and then I have my ambu bag, and I have my sterile water and my kit. I'm going to go ahead and take a listen to the patient's lungs. I hear crackles, so I do know that it is going to be time for suctioning. I'm going to set up my suction to 100 to 120. And I'm going to attach my ambu bag to the oxygen and put it on the highest setting so I can oxygenate the patient. I'm also going to be putting a pulse ox on their finger to make sure that they are safe during the suctioning. If the oxygen were to ever drop below 90, then I would immediately stop suctioning. So now that I've touched my patient and have them all situated, I'm going to go ahead and perform hand hygiene again. And now I'm going to go ahead and open my sterile water. And I got my kit here. I'll go ahead and open this away from me. And I'm going to be grabbing my gloves. Okay, those are all set. I will go ahead and use this as a sterile field. I'm going to grab the other supplies out of my bag. I have my container where the sterile water will go, and then I also have my catheter for my suction. I'm going to go ahead and wrap this one along my dominant hand to retain its sterility. And we are all set there. So now this is going to be the hand that I will be contaminating. So I am going to go ahead and pour my sterile water. And I'm also going to hook up my suction. I'm going to be hooking it up like this. That way there is no contaminating of that hand. And I'm going to go ahead and remove my patient's trach collar. I'm going to check my suction. So I'm putting my thumb on it. It's working. So now I can go towards the patient, and I'm going to be going into the trach, and I'm not touching the trach. And once I meet resistance, which I have, I will go ahead and put my thumb down and remove. Now that my patient does not have their oxygen, I'm going to use my ambu bag and supply them with oxygen. I'm going to clear my line, and I will go ahead and go again into the trach until I meet resistance, and then suction. Get my oxygen. Perfect. And I will go ahead and clear my line again. Now I can go ahead and remove that. I can go ahead and place my patient's trach collar back on so they are oxygenated. And I will remove my gloves.